A very good morning to one and all. Today I am going to do a presentation on the topic, a study on the cognitive status of hypertensive geriatric patients receiving various antihypertensive drugs in a medical college teaching hospital. So coming to the introduction, hypertension is defined as a condition where a systolic BP of 140 or more or a diastolic BP of 90 millimeters of mercury or more, or in some patients both the systolic and diastolic BP remains high for a certain period of time. Even though hypertension is considered as a silent killer, uncontrolled hypertension can lead to symptoms such as tiredness, vomiting, confusion, chest pain, and muscle tremors. There are various risk factors which can lead to hypertension, that is being old, less physical activity, obesity, excessive alcohol consumption, as well as smoking habit. Cognitive impairment is defined as a condition where there is a difficulty in learning new things, performing day-to-day activities, or focusing on certain kind of things. It will affect the different domains such as memory, language, attention, as well as executive function, that is performing daily activities. In this study, I have used a specific screening tool known as Montreal Cognitive Assessment, abbreviated as MoCA. It is a simple standalone screening assessment which gives excessive reliability and good results. Coming to the aim and objectives, the first objective was to assess the cognitive function in hypertensive geriatric patients based on MoCA questionnaire. Second one is to find out the association of various variables such as age, gender, socioeconomic status, educational level in developing cognitive status in this particular patients. Coming to the methodology, it was a prospective observational study performed for a duration of 6 months. Ethical approval was taken from the ethical committee. Patients were selected based on inclusion criteria, those who are willing to participate in the study, and male and female patients above 65 years. They were considered as the inclusion. Exclusion is those who are not able to read and write this particular questionnaire and those who are admitted in ICU as well as ambulatory patients. These selected patients were given the informed consent form. Demographic details were collected by means of data collection form, and then this particular screening tool, MoCA questionnaire, was given to each patient. So for one patient, the total time given was 10 minutes. So the total score is out of 30. If he scores 26 or above, he is having normal cognitive function. If his score is less than 26, it indicates mild cognitive impairment. Based on this, the patients were divided into two. Finally, all the results obtained were expressed in Microsoft Word, Excel, and significance was found out by means of chi-square test. Coming to the results, a total of 135 patients were included in the study for a duration of 6 months, and all were inpatients, and the data were collected from the general medicine department of this particular hospital. In our study sample, maximum patients were found in the age group of 65 to 70 years. Coming to the gender-wise results, males were more as compared to females. Based on the social habits, there were 18% smokers, 13% alcoholic, and 22% were having both these habits, and remaining didn't have any social habits, and 47% were unemployed, and 53% were having proper occupation. Coming to the graphical results, first one shows the duration of hypertension. So in our study sample, maximum number of patients were having a duration of hypertension for almost 6 to 10 years. Coming to the different types of antihypertensive drugs which the patients were taking, almost all types of antihypertensive drugs were taken by the patients, but majority were taking angiotensin receptor blockers. So coming to the main result, that is based on the MoCA questionnaire, we had divided the patients who have passed this particular questionnaire as well as failed this questionnaire. So the fail percentage were more, which indicates that majority of the patients had this mild cognitive impairment, and the pass percentage was less, that is normal cognitive function was less for majority of the population, and impairment was seen. So one of the major discussion which we have found out in our study is the maximum number of patients were in the age group of 65 to 70, and those who are above 80 years had severe cognitive impairment. That is, as age increases, cognitive impairment also increases. It was similar to a study conducted by Sassy, SB et al., who stated that cognitive impairment is associated with older age as well as lower educational level. Coming to the conclusion, One of the things which we found is there was no association between cognitive impairment and socio-economic status, but proper association was seen between cognitive impairment and progressing age. Those who are unemployed as well as whose educational status was less, and those who are not, those who are living in rural areas had more cognitive impairment. And this is the main reference which we have used. Thank you.